Yeah.
Right? They have no idea what's going on. They don't know how much everything costs. The scary part is that you have all these relief veterinarians that don't realize that 1099 is going to get you at the end of the year. That 1099 isn't all yours. So,
Yeah.
Hey, everybody. Welcome to Irreplaceable Truths. It's Dr. G.
Dr. Sintov here.
Dr. Sintov is sitting across the way from me. This is a continuation of our conversation we're having. I wanted Dr. Sintov to stay on. I had more questions, but since you do have the business background, that's one of the reasons why I wanted to talk to you as well, because I believe you would agree the business side of veterinary medicine is not taught.
Is not what?
Taught at all.
Oh.
Maybe they give you a little sprinkle.
Yeah.
A dash.
Yeah. I mean, like Nathan was saying earlier, we at Davis, we were lucky to at least have like a business component to our curriculum, but that was pretty much limited to like how to advocate for yourself and negotiate, not anything about like running a business.
Right. What is the biggest financial thing you've heard of early career vets getting into?
Like obstacles?
Obstacles, surprises, mistakes.
I think just student loans in general, like the amount of them, especially for people that are doing internships after vet school and aren't able to like start paying their vet school loans and have to defer. There's a lot of different strategies that they're probably not taught at most vet schools. Like at Davis, they taught us if you have over like X amount in loans, you should just wait for loan forgiveness and make your minimum payments until then. The unfortunate part about that is when your loan is forgiven, that's income that year, and you're going to have some savings put away to pay taxes on that income of your loan forgiveness. So that's, I guess, just like not being prepared for how to balance, all of your bills with a really high vet school loan payment as well. Would be the biggest financial thing. Most people that are like new grads, they're not coming out and buying houses once they've graduated and gotten their first job. Like, I don't know if that's feasible anywhere in the country right now with the housing market, but
Well, it's a concern because you look at these in general, young professionals, they come out, they rent an apartment for $4,000, yet they go buy a Mercedes, right?
yeah. Well, I think we have a little bit of a bias in that regard, living in Southern California, because you go to other parts of the country and cars are not that important to people. But in Southern California, I've known that since I was growing up, because half my family lives in Illinois, and every time as a kid I'd go back to Illinois for the summer, I'm like, oh, people don't have flashy cars here. When I was in high school, it was all about lowered trucks with airbags and kits and paint jobs and stuff like that, and rims. And you go to other parts of the country, they don't care. So in SoCal, yes, people need to have the nice car. It's a big status symbol. You need the person at the stoplight next to you to care about you. I wasn't raised like having that be something that was important. My dad was a human doctor, and I'm sure he made plenty of money to buy a Mercedes, but he drove an old ass Honda until it looked like it was going to run out, break down on the highway.
So what would you say is the biggest financial mistake that these early grads make?
I think that is probably like it's an opinion of mine, but not saving to buy property. I think that's financially something that's really important, is owning property and not being a slave to rent. Rent is your money going down the drain. You'll never see it again. It's not going towards any sort of asset for yourself. So
any write-off.
And like unfortunately, like I said, like housing prices are high. If you want to buy a home in a traditional way with a 20% down payment, that's really difficult to do with home prices what they are. Like in Orange County, like you're looking at having to put down $200K for a down payment, and then in most circumstances, you're going to need another $100 for closing costs and some quick improvements that you need for yourself in that home. And then there's, like First-Time Home Buyers Act, but you're only having to put down 3 or 5% of a down payment. But now you have mortgage insurance and it's making your monthly costs really high.
But at least you get the write-off.
Yeah, true. So, but I think that not as many people are taking advantage of that either, and are just becoming content with paying rent. There's also things like outside of veterinary medicine and investing that can make you money. That I don't know. I feel like people in other like upper middle class income occupations take advantage of that veterinarians just like aren't well versed in, like
Well, they're not taught.
rental properties and stuff like that. You
Correct.
know, like nobody's doing that.
Rental properties are mailbox money.
Yeah, exactly. Like something you get the check, and you're like, oh yeah, I forgot I have that.
Oh yeah, that's
Yeah.
nice.
Yeah.
You know, and the problem is that, well, at least at Illinois, they're requiring a couple business classes as a prereq, but it's still not a lot. But I mean, there's certain basics that you need to know, right? And you know, and you got to remember though, school debt's not bad debt, right? It's not going to be held against you if you're trying to purchase a practice, because they saw that the banks look at that as an investment in yourself,
Exactly.
right? But school debt could be bad when trying to get a mortgage,
Yeah.
which is weird to me. Like the SBA or business banks are like, oh no, that's good debt, but like the same bank, if you go to the next office, they're like, oh, you want a mortgage? You got a school debt? That's a bad debt, right? One trick I did was I got my school debt swung into my mortgage debt, so it was pretty good. It was actually easier for me to do my school debt into mortgage debt. Then all of a sudden, my school debt interest became a write-off, which was a huge benefit. What a cost savings! Now, granted, I'd pay off my school debt probably for as long as I own a home, but you know what? I'm still writing it off, the interest.
Yeah.
Yeah, you know, and I was also lucky too because during COVID, everyone refied at what, 2%, 2.2%. That's free money. And no one really understands. They're like, what do you mean that's free money? Banks are losing money on my mortgage, right? They want me to pay off my mortgage. And mortgage, you want to die with as much mortgage as possible, in my opinion. But that's a whole certified financial planner to tell you that. I'm not one of those. I'm not one of those. When you see these early career vets coming out, and because you said you have interns that work under you, how much does that lead to their stress?
The financial part of things?
Correct.
I think it depends on the person. Like everybody's circumstances are different. And depends on where they went to school. Also, there's a lot more private universities now that are a lot more costly than state schools. So circumstances are different. I would say, I don't know. It's a thought for everybody. I don't know that I've met anyone that like more so one of my like colleagues rather than an intern that is like very strapped paycheck to paycheck, trying to pay a mortgage and live comfortably and all
pay
of
off
that.
School debt at the same time.
Yeah, exactly. More so than the interns. I think most people with at least federal loans that are interns are deferring, so they don't really have to worry about payments when they're an intern.
But the interest still
Interest
accrues.
accumulates. Yeah, sure does.
It sure does.
You bet.
They're like, congratulations. Yeah, it always blows me away that when you look at the student loan idea, that if you make over $50,000 a year, your interest is not a write-off. If you're going to get a student loan, you're hoping to make more than $50,000 a year, I would
Hopefully,
hope.
yeah.
And it's scary. It really is scary. What do you think veterinary schools should, if you could go back and teach business in a veterinary school, what are the important business acumens you believe veterinary students should receive?
I think it depends on what you want to do, but in general, I mean, I think a lot of this goes back to like the American education system in general, not teaching practical things about life like finance and savings and home ownership and things like that early on. Like we have no we have no education on that, at least in most schools in the country. And when I was growing up, and I'm sure when you were growing up, but yeah, I mean, my advice would be to make a good budget based on what your actual take-home check is.
Not your gross.
Not your gross. That would be really dumb. And always be saving something from each paycheck. No matter how poor you are, I think as a veterinarian, you can probably afford to be a little bit poorer and be putting something like into your retirement account. That was a good piece of advice I got from.
What percentage would you recommend?
For a retirement account?
Yeah.
I'm not sure what's recommended by most financial advisors. I think it's pretty high what most people recommend, like 10 to 20% or something like that. I think it depends on your situation, and if your workplace is like matching and things like that. I would definitely max out matching because that's free money. But if like I get my work, I don't contribute beyond what my work will match me, and then I have other investments that I make.
So matching, basically what we're talking about is the match is if you put away 4% of your paycheck, chances are they'll match you 4%. If you're good, you got to look and see what the stipulations are. It's
and sometimes you have to be there for a certain period of time before they will start matching, and they'll only match, 25% of what you've contributed. But I think that if there is matching, then maxing out the free money that your workplace will give you is
right. So
smart.
Use your calculus that was pre-required, and try to figure out what's the maximum you should put in order to get the maximum match.
Yeah, they're not going to tell you.
No, they're not. They're not. They don't. That's
been a hard lesson too. Is that your employer isn't going to advocate for you regarding your salary and stuff like that. And as disappointing as it is, and like as much of a family environment as the hospital might seem and management might tell you, they're not going to bend over backwards to give you more money than they're currently giving you. And if you feel like you've earned it and you can show that you've earned it with the production that you're making, et cetera, if you're not already on a production basis, then you have to ask. And that's like hard to do for a lot of people, including myself, because I just have like pretty simple values. Like your work should speak for itself. If you're a hard worker and you're doing good work, then it's pretty obvious. And back in the day, your employer would reward you for that, but now that's not as much of the case, especially with corporate hospitals. Like I've gone through a yearly review where they tell you what everybody thinks about you and comments and things like that, and then have left the meeting and be like, oh, wait, they didn't bring up my salary at all. Do I even get a cost of living adjustment? There's inflation right now. And then go back and have to like ask about it, and after previously being told like this will be something that's brought up at your review every year. Like you have to say what you want.
You got to be your own advocate.
You
for
really
sure.
do.
You got to believe your worth. You got to believe in what you can do.
Yeah, and I think it's smart for people to know like what are these companies looking for when they're making their offers for your salary, or what do they think is worthy and what's not worthy. How much should you be making them in order to get X amount of a salary? And I think that's different for every place, but I think all of that stuff is really important to know. And maybe that does go back to, maybe that is something that should be taught in vet school by someone that's owned practices. This is what I expect my general practice doctor to bring into the hospital per year for them to earn their salary.
But I think the worst part for me is they use these three words together, and I can't freaking stand it. Average client transaction.
Yeah.
I mean, it's, and everyone, I'm sure I'm going to get hate, but it's such a bullshit number, right? Because you're an emergency clinic.
That's an MBA number, right?
Yeah, it is. It's a spreadsheet number. I mean, because at least in a general practice, you could do a splenectomy. That's $5,000. And then all of a sudden you sold, 2 cans of dog food, and you did a nail trim.
Well, same in ER. Like Yeah, I'll do
and a no-charge recheck, and that's a zero.
Yeah, a resection and an anastomosis. They end up paying like $10K for their stay, and I did a recheck suture removal for zero.
So you're down to 5.
So that's 5 for
Two visits.
patients.
Yeah.
Then the next one was an exam only. They declined everything else. That was $150.
Right. Well, rule of thumb is, I mean, what you can do really simply is just ask what your gross number is at the end of the year, but you need to also track what you believe is your gross number.
Yeah, that's why I did that the last year for the first time, so that I could have a really good idea of what I'm bringing in on a busy week and a slow week and on an average in a month, and how many. I tracked a lot of details. I did like average transaction, but
and it was all over the place, right? The average client transaction.
I mean, over a year period, like when you looked at it per month, they were pretty consistent. But yeah, if you looked at it from a day-to-day basis, it's all over the place. There's days that in an ER setting I make $3,000, which is nothing, and days that I would make $17,000 because I did 2 surgeries and saw a bunch of other cases.
The corporate that bought my practice, they would look at it on a day-to-day basis. And they'd also look at the gross revenue of the hospital on a day-to-day basis. And off of the gross revenue on a Tuesday, they would say, they would call my manager and be like, don't let 2 people come in tomorrow on a Wednesday. And my only thing is, the only thing those 2 days have in common is they both end in Y.
Yeah. Well, and that's dumb too, because if you have like procedure days, then 2 weeks later, it's going to be a slow day because you're doing a bunch of rechecks for suture removals.
It doesn't make sense.
Yeah.
It doesn't balance out. But, and that's the biggest argument you get from people is that corporate medicine thinks that veterinary medicine's run from a spreadsheet. Mm-hmm. Maybe a dry cleaner, maybe a car wash, maybe, something else. But medical offices are not a spreadsheet.
Yeah, I agree. I think that, unfortunately, a lot of the big corporations are paying a tremendous amount of money to a lot of people that have never set foot in a hospital or seen a hospital run, and just are so out of touch with.
But they all have MBAs.
Yeah, I know, and they make a lot of demands and not even recommendations, like requests, and put on hiring freezes and tell you we're out of this these 3 stats that we determined on the spreadsheet aren't adequate until 3 months in a row you've corrected that, you're in a hiring freeze. And a lot of them, it's like, well, how are we supposed to make more money if we're
understaffed?
If we're understaffed, we have a 5-hour wait time in the ER. The techs are having trouble keeping the hospitalized patients' treatments up to time and taking in new patients. I think they're so out of touch with what's happening in the hospital, and frankly, they're probably getting paid too much for the recommendations that they're making, and it's just a lot of non-clinical staff eating up costs for the company and affecting the bottom line.
Corporate medicine is like looking at insanity, right? You're doing the same thing over and over again and expecting a different result.
One term that I've liked to use is manufactured problems. And I feel like that's common with a lot of management teams at bigger hospitals, especially corporate-owned specialty hospitals, is that, I don't know, like these doctors' meetings, it's the same problems that get brought up month after month. Do they ever do anything about them? No. They like talking about them, though, and like making you feel like you have some sort of shortcoming, that you're not doing well enough for the hospital, and you give your suggestions. They never, or almost never, actually take them into consideration. It can be really frustrating dealing with the management aspect of things, especially at a bigger hospital or a corporate-run hospital, when the actual hospital manager, they're really just at the mercy of the person that's above them, that's giving them directives. It's just getting passed down the pipeline.
Well, I mean, you talk about burnout. Obviously, a big piece is emotional exhaustion, but another piece of it is lack of self-worth. Mm-hmm. And just think about it. You're emotionally exhausted. You're working your tail off. You're trying to do everything you can, yet they're telling you you're not doing enough.
Yeah.
And that's just because they're looking at an invoice.
Yeah, and I had a big thing with that at work recently. They brought up these financial concerns, like hospital-wide, and had kind of said, oh, the ER has these excessive wait times. You guys need to see more cases, blah, blah, blah. And so I worked my tail off for the next few months, kept track of my production, what I was seeing. And I was very communicative with the management and medical director during this time period and saying, hey, here's some things I noticed elsewhere in the hospital. This specialty department isn't maximizing their schedule. How come they're going home at 3 p.m. When the ER doctors are staying like several hours over their shifts? Like maybe they could have a busier schedule and would get shut down on I just no response from comments like that, or you shouldn't be doing reply alls to these emails about this kind of stuff. Like, well, if you're going to share financial information with us, then I'm going to give my suggestions too, because I'm also an econ and accounting major, so it's not like I'm just making stuff up. Like I'm giving real suggestions. But again, back to like manufactured problems, they want to like identify this problem and focus on it and attack it and ignore other stuff that's going on. It can be that can be a big drain on your energy to perform your actual job of being a doctor.
The fact that they don't give a darn is, you know what? I'm going to say it. The fact that they don't give a shit is absolutely infuriating, because when they bought my practice, I don't want to get triggered here, but when they bought my practice, they didn't want any feedback from me. And I'm like, okay.
Well, they know better than you.
Yeah, of course.
Yeah.
Well, they gave me imposter syndrome. So I was like, oh my God, I was doing it wrong. So that's when I went and got my MBA. And then what the MBA taught me is that they're doing it wrong.
Yeah.
Right? From leadership down. You really need to look at leadership that really will at least listen to everyone's opinion, from the stakeholders, and you don't have to act on every opinion, but at least listen and have a discussion about it.
Yeah, I think our new medical director at our hospital is good at that. In case anyone was watching, I truly do though. We didn't have a medical director for the last few years, and so now that we do, it's just a lot different. Like things get brought up that previously just kind of went undiscussed.
I'd probably get fired in 30 minutes as a medical director.
I definitely would.
Because I would call corporate out on all they were doing.
Yeah, for sure. And he's better about playing both sides of the fence and that sort of thing. With I've just never been good at, like you used the term earlier, like disruptor. And I've always felt like that's me too. When I see something that just doesn't make sense, I'm never just going to do it. I'm always going to say something about it.
I'm never going to be quiet about it either.
Hell no. I've always been loud about stuff that just doesn't make sense.
Right.
If it doesn't make sense, then what the heck are we doing? Why are we doing it? I want to know. It's never like, I've always been the one that gets yelled at for talking in class or kicked out of class for asking too many questions or whatever. But if it doesn't make sense, it doesn't make sense.
And the one thing they don't realize is that veterinarians have one hell of an education, and we've been taught to use our brain and think.
Yeah.
Right?
Yeah.
So that is a huge problem for them, is because they're employing a whole bunch of thinkers. And the people that are usually running it and the regional managers, they're usually not veterinarians. And so, I mean, that's why it's okay to voice your opinion, but your opinion won't be heard. And for me, my opinion was used against me, but whatever. It got me to where I'm doing what I'm doing now. I don't think I could ever set foot in a corporate practice again. My wife's like, you really should go back and do some relief and go have, just keep doing what you're doing because you're really good at it. But the problem is, like, I don't know which of these practices are corporately owned now. Unless they say Banfield, VCA.
Yeah.
You don't know who owns who, right?
Yeah.
So you got to be very careful.
Well, I think one thing that's changed a lot also is cost. I work at a corporate, I work at a VCA, and like the costs have exploded since COVID. And I think that's just true with a lot of stuff, especially in California. I mean,
A dozen eggs is $9.
yeah, I was gonna say you go out to eat with your wife, you probably spend like 80 or $100 even at like a like not even a fancy place,
I
you know.
Well, Carl's Jr. cost me. I bought dinner for myself and my daughter, and it was $33.
Yeah, I was gonna say if I get
something.
fast food late at night after work, I spend like $16-17 on a meal.
And that's Taco Bell.
Yeah, it's three. Yeah, exactly. It's 3 times as much as it was 10 years ago. But I think that costs have just exploded, and that's one thing that makes the job even harder. And I think I don't know. I think it started at corporate hospitals, but a lot of private hospitals have started to say, oh, like they're charging that much for an enterotomy, we're going to charge that much too.
No, the trick is what I tell everyone: if you want to own a private practice, just open it down the street from a corporate practice. Find out what they're charging and just do 25% less.
Yeah.
It's the easiest way.
Yeah,
Easiest way to
thought
do
of
it.
that idea. Like my hospital, I've thought if someone opened an urgent care across the parking lot from us, they would make a killing, because there's so many people that decline all of this. Like, do you know how much it costs for an exam, blood work, so CBC Chem and a venous blood gas, and say like an abdominal or chest X-ray? No treatments. Just
I would say $1,200 right off the bat.
pretty accurate. Yeah. So like
That's insanity.
yeah, $1,200 for those things, which I mean, you listen to some, like if you listen to podcasts with like financial advisors and stuff, most people don't have that much in their emergency fund to be able to spend. Like the vast majority of Americans don't have that. They're paycheck to paycheck.
We're in a bubble here in Southern California.
Yeah, for sure.
Yeah.
The vast majority of Americans don't have that money to spend, and if that's just the workup, you know. So a lot of people are declining that and just doing like whatever empirical treatments, sub-Q fluids and Serenia for everything, or you know, they do come up with the money for the diagnostics. Like, okay, great, your dog has a foreign body, now it needs surgery. That's gonna be $8,000 to $10,000, and like, for some people that is absolutely impossible. They either have to euthanize, they have to find another hospital where they might be able to find those services for cheaper. In Southern California, I have to be careful about this, but you can recommend going south of the border and seeking veterinary care, which a lot of people do for human medical care. But I've had people get offended about that, leave bad reviews, and it was never taken. It was never like that recommendation to like go to Mexico for treatment was never given as like a condescending recommendation. It's like, if you want to try to give your dog a chance and you can't afford to do it here, we're only 2 hours away, take the drive, and it'll be like a tenth of the cost that it is here. But it's a pride thing also. Like people just want it to be cheaper, and it's not. It's just going up and up.
Well, we can't control the prices when there's a corporate.
No, in a corporate, like it goes up like twice a year routinely.
My wife's practice went up 5 times in the last 12 months.
12 months, wow. Yeah, I would say in the last 3 years our prices have gone up probably 6-7 times, something like that. Like,
so keep it on the idea of cost of care, and especially in what you do. How much does that play into your frustration with your profession?
A lot. So I think that's probably one of the biggest frustrations is the cost of care and the lack of being able to practice how you're taught to practice.
Because you can save that animal.
Sometimes. I mean, sometimes you can't, no matter what you do.
Right.
That's like, especially in like emergency and critical care specialty hospital setting, that's something to understand.
Well, let's talk about like a gastrotomy.
Sure. Yeah. Most likely you can save that animal. The vast majority of routine gastrotomies do extremely well. But yeah, if the people don't have $7 or $8 to spend on it, and they're not going to do the work to find somewhere that can do it for cheaper, or it's just not financially feasible for them, like that's a big mental toll for sure. Like, because most people that are veterinarians have empathy in general. That's why we like animals and want to help them, and the people that own them. And so, especially if you have to euthanize an animal that's savable for financial reasons, that's a big mental health.
Huge.
It's huge. It's different.
So how do you deal with that? How? I mean, because that's the one piece that still
dark
doesn't.
humor.
Well, that's the one piece school doesn't prepare students for.
That's true. And I mean, they've shown this in people that work in like emergency and critical care settings as well, or just medical settings in general, where you see graphic things, you see death. It takes a mental toll on you, whether you're realizing it in the moment or not. Just being exposed to graphic images um, does have some effect on your brain and personality and all of that. Most people don't see bones sticking out of the skin and bleeding and death and dying and all of that stuff, whether it's an animal or people. Like, most people just aren't exposed to it. So,
well, the perfect example of that, and I brought it up before on this podcast, was when Hamlin went down on the Bills, and
sure,
everyone watching that game and everyone in the stadium saw a man die and brought back to life with CPR. And everyone just had PTSD over it. And the one thing they don't realize is that a human emergency physician probably does that 4 times a day.
Yeah. Yep. And like same with, I mean, emergency veterinarian, same thing. We were talking about that earlier, like going from doing CPR to discharging a patient that is recovering from an enterotomy to telling people that their dog has internal bleeding from a tumor on their spleen that's now ruptured. You have to change your tone and personality. Like, you have to be a bit of an actor. Whether you're like, I don't know, that sounds kind of like fake to say, like, oh, I'm like acting when I'm there, but like,
it's called surface acting.
Yeah, and I don't think it's true acting,
right?
But you have to go in and be really serious sometimes. You learn certain, like, I think we called it like signposting in vet school when we did like our simulated client interactions, like, or like a warning shot, like, hey, I'm really worried about Fluffy. Like, it's the first thing you say to the person. Then they're like,
you set the tone.
Yeah, like they came in not really knowing what to expect. Now, like, oh, this is serious. I'm going to listen to every word this person's saying now. Versus when you come in and you're aloof and, like the dog's got a bone stuck in between its teeth, it's going to be fine. And
done.
So I think there is like a bit of acting involved. And I've used the acting thing the most with like difficult clients. I think your job with a difficult client is, it sounds kind of bad, but like, it's to act and not let your emotions take over and act like how you're supposed to. If you can achieve that and de-escalate the situation and make them happy, you won.
That's emotional intelligence.
Yeah, and
it is.
And if you want to look at it as winning and losing, and it's a competition, and it's easier for you to think of it that way, then you won. You tricked them into thinking you are this very patient person, blah blah blah. But in reality, you did them a service. You did their pet more of a service by being able to calm things down and whatever, bring things down to a more rational level.
Now, I'm pretty sure you've heard horror stories from classmates, other veterinarians. What is one red flag you look for in a client?
That's a really good question. Like, that this might become a problem?
Exactly. Mine is fur baby. When they say fur baby, you know right there, the acting has to come.
Mine is probably because we get a lot of referrals, so patients that have been to one or more hospitals already before I've seen them. So my biggest red flag is them saying negative things about the prior doctors, or having big time trust issues already, which sometimes it's valid, but many times it is just them not wanting to believe what they're told, not being okay with what it means financially for them and their pet, things like that, where they were told accurate information but just aren't receiving it well. Sometimes, like, a lot of stuff's communication, and that's a product of how the industry is set up too. We're trying to see appointments as fast as possible. I realize that a lot when I'm talking to people in the ER. I probably spend more time talking to clients than the average ER clinician, because I feel like it's really important to me that I'm on the same page with the client. And I'll ask people, so what's your current understanding of what's going on with Draco so far? What did your other doctor talk to you about? What's your understanding? What's the diagnosis? What's the plan from here? And sometimes people are like, oh, aren't you supposed to know that? You're the doctor. I'm like, no, I do know that. I want to know what you know so I know where to start the conversation, if we need to go back to the beginning or if we're already there and I don't need to waste your time with that kind of stuff. So that, like, and I find out a lot, like, especially, like, say, take a subject like anemia. My doctor said my dog has a low blood count. Okay, what do you mean by that, low blood count? There's a lot of different blood cells. His red blood cell counts are low. He said anemia. Yeah, okay, great. They tell you why that could be happening. They said that he
has cancer.
Yeah, they said
that's all they hear. They hear the C word.
Sometimes right? That, or like sometimes like they said it's an immune problem. That's really common too with anemia. Like everything's IMHA. There's no other causes for anemia anymore. It's always
either
IMHA.
I feel as if a lot of the new career grads are either looking for an immune problem or Cushing's on every case.
Yeah,
on every case.
Which, like, immune problems could be like a 5-hour discussion. I have a lot to say about that, but
yeah,
because definitely seem more prevalent and in certain areas more so than others, but.
South of the border, all tick-borne.
In any case, like, I don't think that there's often just time in the allotted appointment time for you to have a thorough discussion and make sure someone's on the same page. One thing I do a lot is try to make things algorithmic for people. So I'll draw a tree diagram. Anemia, here's 3 mechanisms of cause. It can be loss, that can be external or internal. It can be destruction, that's immune mediated. Is that primary or secondary? It could be lack of production, that's a bone marrow problem. Is it chronic disease?
Even a kidney problem.
Well, yeah, that's bone marrow suppression from lack of EPO. But like, I'll try to draw things out, and people really appreciate that. And I oftentimes get comments like, "Wow, no one's taken the time to like explain things like this." And I think trying to break things down into simplistic things, like take anemia again, for example, use an analogy of a bathtub with a drain and a faucet. People love that kind of stuff. Like, cardiology is a complex subject that most vets hate. I explain it to clients in terms of plumbing, and most of them get it.
Correct.
And like, I guess one problem I notice with new grads, and I think that it's likely because of like a imposter syndrome thing, they're trying to explain it to themselves as well when they're talking to clients, and trying to.
Well, you have to know both languages. You have to know the doctor
language. You really do.
And you have to know the
you need to know them
language.
well, and you need to know the doctor one enough first to be able to translate it into a layman's language.
Which is another thing they really don't teach well.
No, they don't, and not at all. Because like in rounds in vet school, they won't let you say chest X-ray. It's thoracic radiograph.
Right.
And people like. People don't know what the hell a thorax is,
right.
Like,
well, I always tell, like, because I love mentoring. I think mentoring is amazing. And I always tell them, anytime you go in a room trying to discuss a case, imagine that's your mom or dad.
Yep.
But hopefully they're not doctors, or your best friend. Explain what's going on with this case.
Yeah. Don't use the term non-regenerative. Don't use the term hemolysis. Like, people don't know what these terms mean, and when you start saying them, they tune out because they know that they're not going to understand anything else that you're saying either. And so they miss the basics of what are the mechanisms of the causes of anemia, and why are we doing the tests? Why are we running these tests? What are we eliminating based on this test?
Correct.
So I think that that's a big problem with new grads, is just using way too much jargon and expecting people to understand what the hell you are talking about, because they don't.
They don't. They do not understand.
Unless they tell you they're in the medical field, in which case half the time they still don't understand what you're talking about. Because a lot of people, especially when they start off by telling you they're in the medical field, they've already decided they know the diagnosis and what you do and don't need to do.
Well, Dr. Google gave them the diagnosis.
That, or they're an RN or whatever. And like, human medicine is so much different than veterinary medicine is. So like, I guess that's another red flag with some clients is, oh, I'm such and such, just so you know.
Don't you know who I am?
Well, not necessarily
I've
like
gotten
that.
No, I've gotten that. You don't know who I am? No. I'm Dr. So-and-so.
Okay. Yeah.
That's good.
Yeah. Great.
Yeah. I mean, how am I supposed to know? Are you on TV? Did you stay at a Holiday Inn Express last night?
Yeah,
I have no idea who you are.
Oh, I've been pretty blunt with some people that are really entitled like that are like, oh, so what exactly is the treatment plan? What dose are you giving him? Like they know what the right dose of Lasix infusion is for a dog in heart failure or whatever. So I'll give them the treatment sheet and like, here, review it. Let me know if you're okay with everything and give it back when you're done and we can start on it.
I had a human surgeon call me yelling at me that I overdosed his dog on Cytopoint. I'm like, how did you figure that?
Do you use Cytopoint?
He's like, oh, I went to their website and you look at this chart right here. He read the chart wrong.
Pounds instead of kilos or something. Yeah.
It's like, come on, dude. Come on. Cytopoint's very easy.
Well, human medicine is also a lot different, too, because it's like in vet med, our patients are in every sort of weight range. In humans, it's pretty much like a children's dose or an adult dose.
Exactly.
Like you give two.
Look at a bottle of Advil or Tylenol. Yeah, that's how it works.
But even in an emergency setting, you give 2 ampules of whatever,
Right.
that's the adult dose. It's 2 ampules. It's not how many milligrams is it or how much do they weigh.
And they get away with writing it up that way too.
Yeah.
I gave 2 ampules.
Yeah, well, how much was in
on the
each one of
California
them?
Medical Board, you got to write down how many mLs and milligrams you gave.
Yeah.
Which is crazy, which is redundant, in my opinion.
Yeah, nobody has that much time in either.
But they expect you to have that much time, but yet you get in trouble for not seeing enough.
Yeah.
It's crazy.
Yeah, it's tough, and I think that realistically, it's important to understand that even though you're getting this like feedback from multiple different angles, and it seems like you're never going to be able to do it all. Yeah, that's right. You're probably not going to be able to do it all, but that's okay.
Yeah,
you're not going to get fired for not being able to do it all. I think a lot of people are like afraid about their job security, and like just because they get criticism from an employer, like that they're on the hot seat or something like that. Like you're not on the hot seat.
If you have a job as a veterinarian, you have probably the most secure job there is in America.
Yeah.
Because there aren't any veterinarians out there looking for jobs.
Yeah, and hospitals are begging for full-time doctors. So if you want to sign on somewhere full-time, you can ask for whatever you want, and they will negotiate with you. So I think that's...
For every veterinarian in Southern California, there's 27 job opportunities.
I'm sure.
27. So if you walk into a clinic and you feel like you're there a little while and you're like, this is not for me, guess what? Is it the clinic that's not for you, or is it the clinical medicine that's not for you? Because if it's the clinical medicine that's not for you, then there's other jobs available. But if it's not the clinic, there's other great clinics out there. You just have to find it. You have to find it. And you have to find the one that makes you feel comfortable, one that's going to mentor you, one that's going to give you that feeling, I want to say, warm fuzzies inside. Right?
Yeah. And it's okay to not always have warm fuzzies too. Like, I mean, you're not totally prepared for the career coming out of vet school. Nobody is. And you're not, like, I don't think there's any way to make a curriculum where you're 100% prepared. That's why experience is so important. That's why it's called medical practice. It's not medical perfection, even for people that have been doing it for 40 years and the best heart surgeon in the world and all of this. They're still practicing medicine.
You mean there's not a such thing as a routine dog spay?
No, there's unfortunately not. I mean, hopefully most of them go that way, but like, I've done spay revisions in ER because something dehissed and the dog's bleeding to death.
Or a ligature slipped off.
Yeah, exactly. It's not because they did it wrong. It's just because it's gonna happen. Like pretty much if you haven't had a surgical complication, you haven't done enough surgery yet. Like
exactly.
they're gonna happen.
Like
you don't do enough surgery.
And
if someone's telling you they've done hundreds of surgeries, they've never had a complication, understand they're lying to you. They are lying to you.
And remember also, a surgical complication is like a knife through the heart.
Yeah, it hurts. It hurts the person the surgeon that it happened to just as much as the client. And I think if you can be honest with people when it happened, they see that and they understand that, and they're not going to be mad, and they're not going to sue you. It's also important to take into account, even though we're asked to go between things really quickly and go from this to that, to have the discussion, here are the potential complications with this procedure. Because the less informed people are, the more likely they are to be upset about something.
Yeah, you just got to be honest.
And that's practice as well. That takes years to develop that conversation and kind of titrate it to get rid of the extraneous stuff, nail the important stuff, and make you feel like you've covered your butt, inform the client adequately, so that if something does happen, it's not without, out of the realm of surprise. Like, that stuff's going to happen. Yep, it would be great to achieve medical perfection, but it's not. It's medical practice. Not everything is going to go the way you want.
And you're practicing law too. Just no one's perfected law either, right?
Yeah.
So, what's an unpopular opinion you have about the veterinary profession?
That, like, I personally have that other people don't like. I'll be honest with you. I think an unpopular opinion that I have is that a lot of people try to do too much, or try to do everything rather than limiting the services that they offer, without the proper training and experience to be caring for those types of cases. In veterinary medicine, unlike in human medicine, like, there's certain things in human medicine that a doctor wouldn't dare try to diagnose or treat for fear of lawsuit and losing their license, etc. In veterinary medicine, you're welcome to try whatever you want to, as long as the client approves it, and theoretically as long as you discuss the risks with them. But I've seen and heard a lot and read a lot of bad stories regarding cases that were managed for too long before being transferred, or a surgery that seemed more of like, I'll try this surgery rather than I'm comfortable doing this surgery, that have not resulted in good outcomes, or have resulted in the death of a patient, or the need for me to euthanize that patient in the ER or ICU. And that can be upsetting to someone in my position, having to deal with the aftermath of it. Again, like we said before, you weren't there for the whole story of things either. The people might have declined something earlier or whatever, but that part I feel can be frustrating, and that's an unpopular opinion of mine, that a lot of cases should be transferred sooner than they are. And I think it's mostly unpopular with other veterinarians, not with, like, clients and stuff. But I'm not trying to, like, put down other veterinarians or anything when I say that, because a lot is expected of them. And like I've said, it's a lot of client expectations are like, you're the one to fix everything. You need to fix everything. And so, like, that weight is on most people's shoulders, and they're just trying their best to fix a broken animal or whatever.
Correct. To the best of their ability, hopefully, without doing harm.
Correct. Yeah, and I think that's an important part of it, without doing harm. And I think I've seen, like, just unfortunately in my position, a lot of cases where harm has been done. And I don't want to, like, put down anybody else, but I think that's an important thing to recognize as a new veterinarian, or what are your limitations, and maybe what are some cases that I shouldn't be, like, put yourself in the client's shoes and what you're thinking in your head as a veterinarian. Like, am I trying to treat this, or do I know how to treat this? Am I trying this surgery, or do I know how to do this surgery?
And it's okay to try if you have someone there by your side that's done 100 of them.
And in certain circumstances, if you're in a rural area or whatever, and there's nobody else to do it, and you got to have a textbook open when you do it, or watch some YouTube videos, that's fine. Like,
have at it. You're trained to do that.
Yeah, we're trained to be on the fly people and learn new things quickly, and there's more than one right way to do things a lot of the time. But I think that if there are other resources that are viable, then you should know, like, kind of what are some limitations. And that's also a good way to avoid problem situations as well, especially as a new veterinarian. Because understandably, if you get yourself into a situation like that, and I've seen and heard of that happening, is yeah, maybe you did get in a bit over your head on this case, the outcome wasn't good, and then you feel really guilty about it, or, that affects your mental health quite a bit, a patient outcome that was not favorable, and you feel like it could have potentially been something
Could have been better.
that you did or didn't do. And that happens to everybody. Like, I've had patients, and I'm not claiming that I'm the greatest ER and critical care clinician that's ever lived. I do think I'm very good at my job, but I've definitely had cases where I'm like, man, I should have done this faster, or I shouldn't have waited and seen on this, or I gave this drug and it seemed like the patient crashed after that, and I have to rethink that next time. Again, practice.
Right. It's okay to have confidence. It's not okay to have an ego.
Correct. Yeah. And like, being overly confident is a detriment to the patient, because once you think you know everything, you know nothing, and you're eliminating differential diagnoses. And that's probably a big thing for new grads too, is having tunnel vision and, oh, this is looking exactly like
Cushing's.
Yeah, exactly. Like, it's got to be Cushing's, not a gallbladder that's about to rupture. Yeah. So, not having tunnel vision, like a lot of this stuff you got to learn the hard way, and unfortunately, it's the sting of pride and like an emotional hurt or guilt is how our brain learns. Like, we remember those really sharp feelings in our brain better than routine stuff, and we remember. I bet you remember a lot of really specific cases that went negatively over specific cases that went positively, as far as like specific details with the case. I can remember a ton of cases that...
Well, every veterinarian I talk to has that one case they'll never forget.
I remember tons of resection and anastomoses that have healed just fine, like, vaguely, like the age of the patient and what they looked like. But I can tell you, like, the one that I had that dehisced and the patient died, I remember exactly where in the intestines that was, what I was thinking at the time when I closed it, and like... You know what I mean? That kind of stuff sticks with you, and
you never forget it.
That's part of being the type of person that wants to fix things, is you remember failures really sharply. And that's not something in the world of social media and TikTok that people like to talk about or present to the rest of the world. They like to show their successes and not talk about failures. And that's when I was talking to you about my friend Dr. Kyle Stanley, the human dental surgeon. He talks about that, and what does he call it? Like the light side of dentistry, I think. But just like opening up about, what were some failures that you had as a dentist? What did you learn from it? What would you do differently next time with that procedure? Did you feel like during the procedure that there's something you could have done differently?
Refer. That's what comes to my head.
We hear I think as a GP, referral should definitely not be a dirty word, and it should always be offered to a client. And if they reject it, hey, you know what? On your end, then you feel like you've done everything you can. You're going to do the best to your ability to fix it. You've offered the next step, and they've declined it. Right. And legally, that puts you in a good position as well. So I think referral, and that's hard though at a privately owned hospital, because then you have the hospital owner saying, "Oh no, why'd you refer them? We could have done a blood transfusion here." But we couldn't have also gotten the dog the ultrasound and overnight hospitalization, and
the things that are required by the standard of practice.
Exactly. And like I'll tell you, after my internship, I tried to help start an ER at an existing successful general practice. And they weren't ready to do it quite yet, so I worked general practice for them for 2 months. And like the little micromanaged meetings I had to have with the hospital owners, one of which was a veterinarian, one of which was a business track, college grad that was the owner's brother. They got mad at me for sending an IMHA to another hospital. And the previous day, they had a different doctor had diagnosed it, given a whole blood transfusion, which isn't indicated for IMHA. It should be packed red blood cells, like. Were probably not a big deal, but didn't send out like a CVC with path review, retic count, tick-borne illness, didn't do chest x-rays, didn't recommend an abdominal ultrasound. So I said, you know what? Your dog's anemic again today after getting a transfusion yesterday. Go straight over to the specialty hospital. Your dog needs to stay there.
Right.
And then I got yelled at by not yelled. I don't like that term, actually. I got chastised by the.
But that's a red flag
the
that
management.
early career veterinarians need to see. If they chastise you for doing what's better, what's for the betterment of the case.
That's
and the
a big red
betterment of
flag for the hospital that you're working at and where their priorities lie, and whether their priorities are for financial windfall for the hospital or for what's right for the patient or somewhere in between. And I think, in medicine, it's hard because it is a business. And like as a doctor, if you're just an employee and you don't own the business, your primary concern should be what's best for the patient. And your recommendation should always be what's best for the patient, not what brings in the most money for your practice. If you're a business owner, that puts you in a tricky spot if you're also practicing because...
Well, not really, because let me tell you, because...
Well, I'm not that, so I can't speak on it, I guess.
As a business owner, there are some things that I felt as if I could do, but for the better outcome, I would refer them.
Sure.
And guess what? It built trust with those clients.
Yeah, I would imagine so, because they can tell that you care. And I think that most people, if you're willing to say, I can't do everything for your dog, or, hey, I think a big thing for young people to understand too is it's okay to say the words, I don't know, to a client. They won't think less of you or think you're an idiot. Like I said, I think I'm a very good doctor, and most of the time I have a great grasp on the case, but I have no problem telling people or having the answer to their question be, I don't know.
Or even, you don't have to use the words, I don't know, but just be like, this is actually not straightforward, right?
Sure, I'm very direct, so I'll say, I have no idea. But what I always know is what the next steps are and how we can find out.
Correct.
And that's important as well. And that's hard in veterinary medicine. A lot of people are looking for the diagnosis on day one. And if you look at, in human medicine, we're not getting a diagnosis on day one. You got to go through the labs and the imaging and all of that. So our expectations are higher than our human counterparts.
So do you think that's one veterinary myth you'd want to debunk, is that you're going to know everything?
Yeah, for sure. You're not gonna. The cardiology resident that I worked with when I was a tech, Dr. Josh Morgenstern, he told me. I asked for what's advice for vet school. He's like, you're gonna learn more in vet school. You're gonna learn and forget more in vet school than most people learn in their entire lives. The stuff that you hang on to, which is probably about 25-30% of what you learn, make sure it's stuff that's really applicable to a veterinary practice, what you're doing.
Exactly.
Yeah, obviously, if you're working general practice, you don't need to remember everything about the path floor.
You don't need to know everything about a virus. You don't need.
Yeah, you don't need to know everything about microbiology and.
Yeah, you don't need to know that it's a coagulase negative, gram-positive cocci.
Yeah.
Just tell me what the freaking bacteria is and what I should use to try to treat it.
Yeah.
That's all I need to know. But, that's the problem. The top 10% in every vet's class, they learn everything.
Mm-hmm.
Where C equals DVM is a great way to live. Because you will do better than C's, but you'll learn what's really important and what isn't.
Yeah.
So, weirdest case you've ever seen?
That's so hard, to be honest with you. Weirdest is a broad term.
What's the first one that came to your mind as soon as I asked you that? That's the weirdest case. I can tell you right now.
I don't have a particular one that came to mind. Go ahead though.
Mine was I had a bloodhound that ate a frozen pizza, and it ate saran wrap and everything, and the dog was vomiting, and we took an X-ray, and I was like, what the heck is that thing? So I brought the owner in to look at the X-ray, and I was like, okay, I can see the saran wrap, and I think the saran wrap would make it through. But what is that? And she's like, oh my gosh, that's the purse I've been missing for 3 months.
Nice.
So I had another bloodhound that ate an army boot. The amount of times I've had to go in and get baby pacifiers out is huge.
I've had some very weird cases. I had a dog that the best way to put it, this is really crass, but this like female intact dog got raped by another dog, and it was not like an intentional breeding by the owner. And the dog had a traumatic vaginal rupture with hemoabdomen.
Oh my gosh!
And so I got to explore that and find the like bleeding uterine artery and
spay the dog.
I did spay that dog. But that was pretty wild. We CT'd it. We did a contrast vaginogram. Or the radiologist did rather, and he pretty much saw everything that I needed to see in surgery. The surgeon, of course, didn't want to stay late to do that one himself and said, "You'll be fine." It was hard to see that caudal in the abdomen to where the uterine artery was bleeding, and I called the surgeon. He said, "Oh, just rondure off some pieces of the pubis. You'll get better exposure because you can retroflex the bladder." And I was like, "Yeah, so I'm not going to do that. Rondure off pieces of the pubis. No." That was a pretty weird one. I've had plenty of like resection and anastomoses that I like wasn't expecting. Like a couple weeks ago, had a 10-week-old husky puppy that had a pyloric outflow obstruction and linear component in the duodenum, and explored it, and it opened the stomach, had a cross from a rosary in the stomach that was anchored in the pylorus, and then the beads from the rosary into the
Linear
duodenum and jejunum, and had like 6 perforations in the duodenum. So we resected most of its duodenum up to the pancreas. Again, 10-week-old puppy. She came back. Her name was Moon. She came back a couple days ago when I was at work and got her sutures removed.
Yeah,
Doing great.
kittens heal from everything.
Oh yeah, puppies and kittens, like they heal really, really well. Be like the least afraid of resecting bowel in a puppy. Yeah,
because they're rapidly dividing cells anyways. So.
Yeah. But I've had plenty of really weird internal medicine cases. Some of which they just end up responding to treatment. Others that you end up coming up with some weird diagnoses. Like Southern California, we don't see a lot of fungal disease, but have diagnosed some dogs with blasto and histo and valley fever.
Well, valley fever we see.
Valley fever we do a little bit more. I think less in SoCal than in NorCal, but in any weird medicine cases. Another surgical one, I saw a 1-year-old dog that swallowed a socket wrench extension that was electrical taped to a 15-inch piece of wood. Swallowed the whole thing. On rads, I'm looking at him with the radiologist. I'm like, I think this piece of wood is intraperitoneal. Like, I don't think it's in the stomach. Because you could see these striations from the dog's pubis all the way up to its diaphragm. And the surgeon ended up exploring it, and yeah, sure enough, this dog had a piece of 15-inch piece of wood free floating in its abdomen, had perforated its stomach. Any piece of the intestines that the surgeon touched just fell apart. We had to euthanize the dog.
On the table.
The dog was still eating before it came in.
Unbelievable.
It's just wild what dogs will tolerate, and speaks to how hard it is to tell when some animals are actually sick. And I feel
you made me think of another one. I had this Jack Russell that came in that was out at the barn with the owner who was with her horses, and she's like, he disappeared and he came back and now he's bleeding. I'm like, oh, that's weird. He's bleeding from there. So I took him in back to lift his head up to shave it up so I could see it. As soon as I lift the head up, boom, the dog collapses, turns blue. I'm like, what the hell is going on? Got like a cat trach tube down the dog because it was all swollen. Found out that the dog had gotten bit by a coyote and it had a 300-degree tear of its trachea.
Oh, nice.
It's a Jack Russell. That's the only reason the dog was like that. But yeah, you get things that are so off the cuff that are actually exciting, and so rewarding when they do well.
Yeah, and I think as a new grad, seeing medications work is really neat. You treat a dog that's in decompensated congestive heart failure with Lasix and watch them start breathing in a sedative and watch them start breathing better.
And then they're doing
It's pretty rewarding to see that kind of stuff happen, because everything's just like a clear liquid in a bottle with some letters on it. But seeing the things actually work is rewarding. I don't know. As hospitalist, I had a big aggressive Presa Canario in hospital a few weeks ago that had ITP, primary ITP, and he was losing a lot of blood in his GI tract and had to have some big boy transfusions because he's a really big dog. And that was a rewarding case. Like, he had been treated by his primary, weren't really quite sure what's going on, so he was on a few different meds, nothing really helping him. And then, my primary suspicion was for ITP. We did a full workup, didn't find anything else. It was primary, most likely. We sent out a special flow cytometry test to Colorado State. They confirmed that he's got autoantibodies against his platelets, treated him, and over the course of several weeks, he responded, and he's doing very well now. And there's, that owner was like at the brink of euthanasia. Let's give it one more night, and then his PCV held steady, so he got to go home from the hospital and do things more on an outpatient basis from there. But, there's medicine cases that are exciting as well, not just surgical stuff is immediate gratification.
Correct.
But medicine cases are gratifying as well, just differently.
Last question for you. What could you see yourself doing if you weren't a veterinarian?
Something creative, not that's like non-intellectual. So working at a nursery, or just woodworking, or being a musician, those sorts of things.
Yeah, I always saw myself working at a nursery as well.
Yeah, I love
What's
plants,
the worst
man.
that can happen? You kill a flat of impatience,
Hey, well, they know plants feel pain now, so cloning plants. I don't know. We have to rethink things.
Yeah, exactly.
But yeah, it's just so peaceful to be around plants.
Well, I just want to say thank you for being here again.
Thanks for having me.
Absolutely, it's been absolutely awesome. Make sure if you guys have any questions, put them in the comments. We'll make sure we can try to address them as well. Because we're learning as well. We never stop learning, and especially us, especially me, learning from your questions and what you want to hear. That would be huge. Just because I want to make sure we're here for a reason, which is to help those that want to be helped and need to hear the words in order to feel that, oh my gosh, other people have gone through what I'm going through. So again, thanks. And we'll catch you next time.